plan. So obviously we do have very similar plans, but there are differences. And most of you probably received the summary sheet that we have here that looks like this. And I'm going to hit just some high points, but then I'll be able to open up for questions as well. Certainly, if you have something very personal, I'll be sticking around later as well, like Dan, and I'll be more than happy to visit with you one-on-one. To begin with, just as he mentioned, we're both HMO plans. With our plan, you do have access to many of the hospitals and clinics and physicians within this Central Texas area. So certainly you have access to the Scott and White Temple Clinic and hospital and the physicians associated with that. In addition to, in the Waco area, the Hillcrest Hospital and Physicians and the Providence Hospital and Physicians. There are a couple Providence doctors who I understand that are not on our plan, and certainly if that's someone that you see and you would like to see if they can come on our plan, then certainly let us know. But for the most part, I tell people you're pretty safe in knowing that the majority of the physicians all throughout Central Texas, the majority of them are on our plan. You also have access in the clean area if you happen to be that far. The Metroplex hospitals in the system. There are also a handful of doctors in that area that are not on our plan, but just a few. So that's just a real quick recap of the network. You can always go to your CRS website for more detailed information on what providers are available to you, hospitals and clinics and such. I'm going to go ahead and begin to give you an overview of what's new for your plan you're starting in September. The number one thing that I want to share with you is that we were able to reduce our premiums by almost 15%. So this year, we're really, really excited about our plan because the premiums did go down for you. You were able to keep your same office visit copay of $20, which is key. When you see your primary care physician, it's still the same $20 office visit copay. And then thirdly, we were able to reduce our generic prescription copay to $3. And you do not have to meet a deductible for that generic, which is pretty awesome because on our plan, nearly 80% of our health plan membership takes generic drugs. And so when you're on a generic prescription, it's pretty awesome to know that really and truly most of the people are taking generics and that you especially, you have a $3 copay on our plan. So that's just a real quick snapshot of some of the key things I want to share with you. We did add a deductible to our plan this year. So that is something definitely new for you. We did have a no deductible plan this past year, which you may be currently on, but in the new year you'll have a $750 deductible for an individual, and then for family it's $2,250. All of our copays and co-insurance do apply to our annual out-of-pocket maximum, and I'll go over that amount in just a moment. But the copays and any co-insurance go toward that annual out-of-pocket maximum, so it's not the deductible. The specialty office visit copay did change. It's now a $50 copay for that visit. We're very similar to what he mentioned in that no referrals are required on our plan. However, always know that there are certain specialists that will still want that referral, just like you mentioned earlier. If you're being sent to the cardiologist for a nuclear stress test, they may say, hey, we still need a referral from your primary care doctor. But we as a plan will not require it any longer. So that's something that's new and very exciting to tell you. Also, you do not have to declare your primary care physician to us. As an HMO, we've always operated where you had to tell us who your primary care physician was and let us know, and if you wanted to change, you had to call us or work through those processes. That's not required any longer as well. So those are some great positives. Some new hospitals, just to mention to you, is that may not apply to you, but we have a couple of new hospitals, one in Brenham that's joined our plan, one in Llano, and one in Taylor. So those are some new ones that came on board. As a quick, continuing on about the benefits, I have this little chart here that I'm going to go over. We've already mentioned the deductibles, $750 for individual and $2,250 for family. The out-of-pocket maximum is $3,000 for individual and $6,000 for family. It works very similar to your other plans in that you meet your deductible, and once you satisfy that, then you go into meeting your annual out-of-pocket maximum. So you would meet both of those levels. Outpatient surgery facility, I've already talked to you about the copays, so I'm going to pass that and just go into, preventive care also is a zero copay. So for your annual well women visit or your annual physical for the guys or the well child checkups for the kiddos, it's a zero copay. But always keep in mind, if they do something to you that turns into diagnostic, anything real diagnostic, then you'll end up going into some cost sharing there. But when you're into just a routine, annual type physical, things of that nature, and it's a preventive office visit, then it is considered a zero copay. Your outpatient surgeries is a $100 copay with 20% after you've met your deductible. So, for example, if you're having outpatient surgery, you would be responsible for that first $100. Then if you need to meet any of your deductible, you would go and meet that. Once you satisfy that, then you go into the 20% co-insurance portion, okay? The protection there, just as any of your other plans, is that you only have that annual out-of-pocket maximum to meet. That's that cap for you, that protection. So always keep that in mind when you're doing these cost-sharing things. Again, outpatient, $100 copay, and then 20% after deductible. Very similar to your inpatient stay. It also has the $100 per day, up to a maximum of $500, and then 20% after you've met your deductible. Structured in that way. And then the emergency room, $100 copay per visit, and then 20% after deductible. As always, your $100 copay is waived should you be admitted. So that's a real quick snapshot of the medical part. I'm going to go over the prescription. With the prescription, we still have our $50 deductible to be met, but again, it does not apply to your generic prescriptions. It would apply to all the other tiers, and all the other tiers are the same. You have your retail, which is like your 34-day supply, and then you have your maintenance, which is a 90. With the Scott & White Health Plan, you still need to get your maintenance prescriptions through a Scott & White Health Plan pharmacy. There's one here in Waco and several in the Temple region to help you. So always keep in mind you need to fill those 90-day prescriptions at a Scott & White Health Plan pharmacy, or you also have access to mail order. I myself, I live in the Waco area, but I work in Temple, and I'm on the road a whole lot. I take cholesterol, have for a couple years now, and I use the mail order, and I always like to encourage people to consider that. You may have experienced it on another plan. I just want to share with you my personal experience that for me, I go online and just re-up it, fill it out, very quick and easy to do, and I generally get my prescription at my home in Waco within about 3 days. They promise a 7 to 10 day window. I've never ever gone that far out. I've always gotten it within a 3 to 4 day window, usually 3. So I just want to let you know, if you're someone who is able to really plan your refills and request them in a timely manner where you don't just completely run out, but you see where you've got about another week's worth or so, that's a great time to go online, fill it out, and they'll get it to you very quickly. So I want to encourage you to think about it. If you've never tried it before, it might be something worth to consider. Lastly, just a couple quick things to hit. We do have some wonderful online tools. You can go onto our website, and certainly through the TRS website and also the Scott White Health Plan website, and access provider information. You can order another ID card if you've lost yours and need an extra. But what I like to really share with people that's really key is that when you're on a deductible plan and you're doing some cost sharing, you want to be able to track what your part is, what you're responsible for, especially if you're having a lot of tests done or procedures. You can actually go onto our website and log in, create a personal password, and that will enable you to go into what's called your explanation of benefits. You'll be able to see, as your claims get processed, what portion the health plan's paid, how much was allowed, what your part is, and so on. So it's really nice to be able to track your billing information. And if you're like me, you get bills from other places, maybe from Scott & White, you've gotten a bill, stuff from the health plan, you get confused in all the paperwork, you don't know what to pay. This is a great resource to just go right online and be able to track your own personal information that way. So I wanted just to share that tool with you. We have some great online wellness things to access. But the last thing I really want to cover with you is that we have what's called a dialogue center. When you go onto our website, it enables you to access some medical type information. For example, if you're someone who has a chronic condition, some type of medical condition you want to research, our online tools are there and accessible to you. I know that one of my friends, she was just having some back problems, and she went on, was able just to kind of research what are some of the options, because her doctor was talking to her about several different procedures to consider to help her. And she just really went online and was able to research it. But the thing is that she took it to the next level and was able to get online and communicate through an email format with a health coach and go back and forth and talk about her condition and what was going on. And that's something that's available on our plan. Let's see, if I have anything else. Those were just some of the high points. Oh, we do have 24-hour nurse advice line. That's been available to you for years. But what I want to share with you is that it's 24/7, 7 days a week. So even when our office hours are closed, for example, you will be able to talk to someone. We have hours that you can come in, extended hours even in our health plan office location in Temple that you can come and stop by. So those are just a recap of all overall benefits and general information about the Scott and White Health Plan. Now I'd like to open up for any questions. I know I saw a couple people over here looking a little bit anxious, so I'll be glad to start over here. Yes, ma'am.
This $100 copay when you go to the ER.
Yes, ma'am.
That's not included in your deductible. So not only you're paying $750, you're going to pay the $100 on top of it, and then the 25%.
Yes, you pay the first thing right off the bat, the $100. That's correct. And then yes, you'd satisfy your deductible if you've not met that. Then go into the 20%. Okay. It's kind of 3 different steps, but then ultimately that annual out-of-pocket maximum is your protection. So there is a stopping point. So even though you're thinking I'm paying the deductible and so on, there is that stopping point for you. Questions? Yes, ma'am?
I wasn't sure if I understood you. Did you say that when you go to your primary care physician, you pay $20?
Yes, ma'am.
Did you say that does go to meet that copay?
Not towards your deductible.
Okay.
No, ma'am, it would go towards your annual out-of-pocket maximum. So that's what it would go towards, yeah. So you'd be paying your copays. Usually what I tell people is your copays don't go towards your deductible, but usually if you have anything else going on, you're having to really get involved into some payments and such, then it's going to feed into your, helping you with that deductible. But those office visit copays don't. Yes, ma'am? Anybody else?
The eye
Yeah.
doctors, does it matter
Yes, ma'am.
which eye doctor? So that free exam is anywhere or certain eye doctors?
It's certain eye doctors. She's asking about the eye exam, and certainly most of the eye doctors in the area are on the plan. What I tell people is don't go walk into the nearest Walmart. Well, they generally are not on our plan. Go to the website, look for your optometrist, ophthalmologist. That's the best way, and most of them are on our plan. So, but there's some that are not. In that example with Walmart and stuff like that, they're not usually.